Module 3, Objective 11, describe how fractures heal and characterize fracture types in bold print. Fractures are cracks or breaks in bone due to physical stress. They can either be compound or open, where you have actual breakage of the skin, or they could be closed or simple. Fractures are repaired in 4 steps. Here is a list of the 4. We have pictures and figures that go along with each of these. The first step, you get the formation of a fracture hematoma. This is the production of a very large blood clot that is going to ultimately stop the bleeding. You get the establishment of a fibrous network, and bone cells in that area begin to die due to a lack of regular vasculature supply. Let me jump to a photo of that. So here you have the initial break of this tibia. You can see you get the formation of the fracture hematoma. The fracture hematoma is going to stop the blood from blood loss, basically. So it's a large clot that is located inside. You get the osteocytes within these bone fragments. They're going to die, and those bone fragments are going to slowly be dissolved. I'm going to back one slide. The second step is callus formation. Cells of the endosteum and the periosteum divide, and they're going to migrate into that fracture zone and form the callus. The callus is going to stabilize the break, and we have 2 calluses. The internal callus is going to develop within the medullary cavity of the diaphysis, while the external callus of cartilage and bone is going to surround the outside of the break. So here you get the formation of the external callus as well as the internal callus within the medullary cavity. And that's going to stabilize. So you get the formation of cartilage and then bone, and that's going to reestablish the integrity of the bone while it continues to heal. The third step involves spongy bone formation. The osteoblasts are going to replace the cartilage within the center of the external callus with spongy bone. So you can see here we have the external callus, and osteoblasts are going to replace the cartilage within that external callus and form new bone. And then lastly, compact bone formation. Repaired bone is going to be slightly thicker and stronger than normal, and this can occur upwards of a year while we wait for this external callus to slowly be eroded away through remodeling. If the bone is set within the first year, it's very likely that this external callus will completely be absorbed, as well as the internal callus, and the bone will be pretty much like it was before. But again, that's if the bone was set. If the bone wasn't set, then you're always going to have some type of deformity where the bone was, the 2 parts of the bone were not realigned. There's lots of different types of fractures. The ones that I would like you to recall are those that are bolded. So the transverse, the spiral, the displaced, epiphyseal, and the compression. But I'd like to spend just a few minutes to kind of go through these. They're very common. As clinicians often see these in emergency departments or even walk-in clinics as folks break bones and then come to have those repaired. We'll start with the transverse fracture. Transverse fractures are breaks in a bone shaft across the long axis of the bone. So what bone do we have here? I'll give you just a minute to try to figure that out. One of the things you should have noticed, and I'll change my color so it's a little easier to see. Here we have the head of the radius, so that would make this the ulna. And we can see a transverse fracture right here. We have just basically a break across the shaft of the long bone. Okay. What about this middle bone? And it represents the displaced fractures. Displaced fractures produced new and abnormal bone arrangements. So you can see the bone has broken and it's not aligned. So you have a new arrangement of the bone. If this were to heal, you would very likely have a very large external callus for some time. It would probably never look the same prior to breaking. What bone do we have here? This one's a little more difficult to identify. I do believe it's a humerus, though. In the third example, we have a spiral fracture. And in spiral fractures, you get a twisting stress that produces a spread along the length of the bone. So spiral fractures are very common in the lower limbs. As someone playing sports, if they were to be running and they were to plant their foot and their body were to twist, that twisting force causes this spiral fracture. And of course, this is the distal femur. We can see the knee here, including the tibia as well as the fibula. And of course, the femur is the bone that is broken. A comminuted fracture is one in which you have large chunks of bone that are kind of loose within this fracture. Of course, this is the proximal femur. We can see the head of the femur up here. That would make this bone the coxa. And just below into the shaft of this femur, very proximal shaft, you have this very obvious nasty break, which represents a comminuted fracture. So you get a shatter of the affected area, and you have multiple bony fragments within that area. Epiphyseal fractures occur at growth plates. Here we have the tibia, and we can see a very clear growth plate right here with the epiphyseal cartilage. And then, of course, we have the distal femur, and we have a growth plate right here that has been destroyed to some degree. So this is an epiphyseal fracture. The important thing to remember about epiphyseal fractures is that this growth plate allows for the elongation of the bone. So if broken prematurely and not repaired so that that cartilage is reestablished, then that bone may no longer elongate here. And having one leg shorter than the other, even by just a centimeter, could cause some major physiological issues in terms of the dynamics associated with walking. So it's very important that individuals who suffer epiphyseal fractures, that they go to an orthopedic and let those particular fractures kind of be reset so that that can heal properly. A green stick fracture, such as this fracture of the radius, occurs when you have a fracture on one side of the shaft. And the other side is relatively unaffected, although it may be bent. This type of fracture is very common in children whose long bones have yet to ossify fully. Green sticks commonly occur upon a fall or some type of trauma that literally impacts one side of that bone and not the other. What bone do we have here? Well, if you identify the thumb here, we know that the radius runs along the thumb. So it's the radius that is fractured. Also notice the presence of this growth plate. So this is a prepubescent individual. Compression fractures. These are fractures that occur in vertebrae due to very strong stresses. The forces that occur when an individual were to fall and land on their feet, and it's just that compression stress that causes these compression fractures. Compression fractures are also associated with osteoporosis. As individuals age, they lose the bone density, and as that density is lost, compression fractures are quite common. So this is somewhere within the vertebrae. If I'm reading these right, we should have ribs right here, which would suggest that these are thoracic vertebrae that are affected. The last two includes Colles fractures. Colles fractures are breaks in the distal portion of the radius. This is very typical if you consider an individual falling and then throwing their arm out to try to catch their fall, breaking the distal radius and getting a Colles fracture. This particular individual, we see some growth plates here within the metacarpals as well as here in the radius and ulna. So this is a very young prepubescent aged individual who had suffered this particular break. Lastly, the Potts fracture. This fracture occurs at the ankle and affects both the medial malleolus and the distal tibia of the distal tibia, as well as the lateral malleolus of the distal fibula. So it involves both the tibia and the fibula. And you can see that parts of the tibia and fibula have completely severed off right there above, well, I'd say it's at the ankle, basically. But it's just above the foot bone here, the talus.